Hello, and today my guest is Dr. Michael Berry of can't talk today. Conquer Chiropractic. How are you, Michael?
I'm doing well. Thanks so much for having me on.
Oh,
It's
I'm
really
so
a
glad
pleasure to
you.
be here.
Yeah, thank you so much for coming on. I really appreciate it. I really believe in the value of chiropractic because I've gone to many chiropractors and Uh, it's all very different, and some I have not really cared for, and so I find another one that's good. But when we first met, you were kind enough to show me, your methods and provided quite a bit of information, and I would like to let so many other people know what you have to offer. So, first of all, let's go to you though. What prompted you to want to become a chiropractor?
So I've actually known that I wanted to be a chiropractor since my sophomore year of high school. I had always been under chiropractic care, and I actually wasn't sure what I wanted to do with my life. I mean, I was freshman, I was really young at that point when I made the decision. So I was playing football in high school and I ended up with an injury. And I went to a chiropractor to just try and get some help, trying to get back out there. And had a really good experience. I was back on my feet a lot quicker than I would have normally been on my feet had I not sought a chiropractor out. And it was at that point that I was like, hey, you know what? I want to do that for somebody else. So just ever since that point, in the middle of that football season, my sophomore year, I was like, you know what? I want to do this for other people. And everything ever since then, everything that I did was geared towards being a chiropractor.
Nice, nice. It's wow, it's such a young age that you knew what you wanted to do. That's fantastic. And where did you go to school to become a chiropractor?
So I actually received my degree at Palmer College of Chiropractic in Davenport, Iowa, the
Mm-hmm.
fountainhead of chiropractic.
Right. Yeah. Yeah. That's been around for over 100 years, that college. Yeah,
Oh
that's
yeah.
fantastic. That's fantastic. And so the name of your practice is Conquer Chiropractic, which I said correctly this time. Uh, what prompted you to name it that?
So we just really wanted people to feel encouraged
Mhm.
when they came in and just confident in the fact that one, we're going to allow them to conquer their goals, but also conquer their health, right? So it's really important to us that we take care of the people that walk through the door, and we think we do a really good job of doing that, and we actually have make them feel empowered and make them actually feel like they're conquering everything that they want to do every day. So it's something that we just wanted to use to encourage people, but also just make it sound strong because that's what we want to do. We want to make people feel strong and get them back on their feet.
I like that. Yeah, conquer their health. That's fantastic. So, who do you how can I put this? What kind of people do you especially like to adjust? Is it older people? Is it kids? Is it athletes? I mean, you'll of course work with anyone, but is there a certain person, or I think I'm saying this correctly, someone in particular that you especially like to adjust? Does that make sense?
It does, yeah. So I mean, for me, it's kind of funny. It's developed, right? When I was in school, I was like, I want to do this, and now all I think about is people that are like me, uh, trying to maintain an active lifestyle, trying to play with their kids. I really just want to make sure that everyone can do what they want to do without having to think about, well, I can't do this because that'll hurt my lower back. Um, Injuries really tend to limit us and it's a driving factor, and I just want to eliminate that for people. I want to help people like me that it's always around my age, right? So it's really just get you out there, get you back to doing what you want to do. One of the really common questions that I get from people is like, oh, do I have to, like, what should I do? Should I not do this activity because it might aggravate it? And my answer is always no. Uh, do it. Do the activity because I'm here to figure out what your body is doing and how it's responding to the activities that you do. If I tell you to just restrain yourself and not do those activities, we're not really helping you. The best way to help you is determine how your body's adapting to your everyday activities and the things that you enjoy doing, because that's the goal. We want you to be able to do that without having to think about it.
Nice. Yeah, I like that. I know something as simple as getting down on the floor and playing with your kids, or as far as my age is concerned, grandkids, which that should be happening hopefully in the very near future because my daughter's due date was yesterday.
Oh, congratulations.
Yeah, thank you so much. Um, yeah, there's just so many things that I think people just aren't aware of that they take for granted, or they say, "Well, I'm this age, it's supposed to happen." No, it's not. It doesn't have to, right? With people
Oh
like
yeah.
you that offer the wonderful service of chiropractic care, they don't have to say, "Oh, it's supposed to happen." Do you hear that a lot?
I discourage that strongly, right? People are like, "Oh, I'm just getting old." And I'm like, "Yeah, but no, that's not how it works." Um, Denial, right? They're always like, "Oh, let's just accept it."
Hmm.
And the most common thing that you hear is, "Oh, I have arthritis." Like it's like a badge of honor. Like, no, forget that, right? It's not a limiting factor. You don't have to be restricted because you have arthritis.
Hmm.
So I can't reverse the generation that's already there. But what I can do is just get you back out there and make sure that it's not limiting you and keep it from progressing as quickly as it has.
Well, I'm glad that you mentioned arthritis because there is one thing that you offer that not many chiropractors do, and that's laser therapy, right? Do you still offer that?
Yeah, yep. I have a cold laser that I like to use. It's an awesome tool. It's very non-invasive, but it restores mobility to different areas. It also helps with like scar tissue. But what it does is it encourages healing. It's like a low-grade heat and encourages nutrients to come to that area for healing purposes. It's really a very cool and dynamic tool.
I've had um I've had the experience of cold laser therapy, and it does. And what I've learned about it, as I'm sure you know, but I wanted to bring this to attention of our listeners, is that if somebody has metal in their bodies, like they have oh, what's the word? Just any kind of metal, for whatever reason, a pin or something, that when you use the cold laser therapy, it doesn't heat up that metal inside their body, correct?
Right, it does not. Where like electrical muscle stimulation can be harmful in those areas, the laser is very safe.
Nice. Yeah, because when they think of, oh, it's going to be a little warm, and then well, is that going to do something to, you know, that pin or whatever I have in my body that's metal? And because that could be scary, right? That it would heat
hmm
up. So that's what's really nice. Now, do you offer that service a la carte, if you will, or do they have to come in and get an adjustment?
No, I don't really require anyone to get adjusted. However, when they know the benefits of it and understand that it's all of it works together to actually promote healing in the body, they're more excited about it. Whether they come in initially just for cold laser therapy, which
Hmm.
they can do, but usually they're a little bit more excited after they leave about the different things that we offer here.
Nice. And you do offer massage therapy too at your office, correct?
Yes, yes, we do.
Nice. Now, do people come in strictly for massage therapy, or do they, have a massage and then get adjusted? How does that usually work?
We actually have a really good combination of both. We have a massage therapist in-house, and you can come in just for that. We do not require anyone to be under chiropractic care to receive a massage. We do have people that get a massage and then also get adjusted. They work so well together, and what we really try to do is make sure that we communicate amongst ourselves. So I will actually, after you've spent X amount of time with the massage therapist, we kind of talk to each other in between while we're transitioning out of the massage room before the adjustment so that we can kind of figure out different areas that the massage therapist picked up on, in terms of, hey, this area is really tight. This is what's going on here. It's a really good way to approach it, I think.
Yes, yeah, I mean, have the muscles loosened up before you try to, adjust the spine and neck and whatnot. Yeah, definitely. Um, so you offer several different services. It's great, because there's so many chiropractors in the area, right? You can drive just a short amount of ways and find a chiropractor. But I personally feel it's good to have someone refer a chiropractor to me. I want to know that they've, had good results from a chiropractor and not just go in cold turkey, if you will. That's one of the reasons I wanted to have you on here because I know you, I like you, I trust you, and it's about supporting people who do a really good job like yourself in the community. So I really appreciate that. I know you have a young family and really like small businesses of every kind to succeed. So we're going to finish up here. And is there any, one last tidbit that you would like to leave with our audience?
Yeah, so I know you like to you said that you like to refer, especially to people that you know, like, and trust, and that's a big deal. It strikes home for us because I like to refer people that I have a connection with. Um, our goal here is to connect with our patients and actually make sure that they are getting back to doing what they want to do. We care about your softball league. We care about you getting on the ground with your kids, and we'll ask you about them. We offer long treatment times, right? So the industry standard compared to that, we're spending 3 times more time with our patients because it's important to us that we're actually addressing your concerns as the patient and that we're actually giving good feedback and good treatment to our patients so that they can achieve their goals. And that's really what we strive on, and that's what we find important, and it's just what we want to do. That's our duty right there, is to make sure that people can get back to their life.
Oh, that's great. And I just have to ask another question though. When you said the standard amount of time that is recommended for chiropractors to be with their patients, what is that? No, that amount of time.
So when you look at a higher volume practice, they usually get around 5 minutes. That's the standard, is a 5 minute appointment, um, kind of in and out, because
Hmm.
it's about the numbers. It's about getting them in and getting them out quickly and efficiently.
Mm-hmm. And that's where I think a more holistic approach for doctors like yourself should go against the grid. That we're doing this differently than what you would, go get a prescription or whatnot, and give more time, right? So I really
Hmm.
respect that. That's great. Your patients know that you care. That's
Yeah.
fantastic. So where can someone find you? Like they say, well, I'd like to know more about Dr. Berry. Where can I go to, see where he's located and maybe make an appointment, things like that. So where can they find you?
So you can find me on Google. I am online. There's online booking available on our website. We're also on Facebook and Instagram. And on Instagram, we actually have our online booking link in our bio. But if you just search Conquer Chiropractic or Brighton Chiropractor, we should pop right up for you.
Great. That's fantastic. Well, good. Well, thank you so much for your time and education too. I learned some new things today. So that's always good. Thank you, Michael.
Yeah, absolutely.